Very good morning to all the participants of this very important international conference on integrative medicine and holistic healing. I must apologize to all the participants that I am unable to be there personally, but I thought I will interact and give my presentation through this link. And I am so happy that Dr. Sachin Gupta, the Associate Director at the Max Hospital, Mohali, and Ms. Nimrit, they have taken initiative to hold such an international conference where you are bringing all the medical practitioners, the allopathic systems, and also yoga, naturopathy, acupuncture, and many other disciplines, Ayurveda, Siddha, Unani. It's a big compliment that we need to integrate all the systems of medicine ultimately to provide the holistic health care to the 7 billion people across the globe. India has taken a big lead in terms of establishing an Indian systems of medicine in the form of a Ministry of Ayush, which is propagating, promoting, standardizing the quality of education, therapy, as well as the promotion of this across the globe. And today, yoga has become global thanks to our Honorable Prime Minister, Shri Narendra Modi ji, who has created history in taking yoga to the United Nations, and the International Day of Yoga is being celebrated globally on the 21st June. Now I am going to talk to you about integration of science, medicine and spirituality, the belief and fact, because some of the belief which existed in these Indian systems, traditional systems, how do you validate experimentally? I am going to give my experience, research, data which I have collected over a period of 4 decades, and how do you integrate science, medicine and spirituality? What are the scientific and the philosophical or belief aspects of it? Science is a double-edged sword. You can use it for constructive purposes as well as it can destroy. So it's a double-edged weapon. But spirituality is a great power for balancing mind and body, to provide a positive thinking, positive visualization. Yoga and meditation can create that unification. And in the spirituality, I would like to say that we are just not human beings looking for the spiritual experience. I believe that we are spiritual beings who have come to this world to have human experience. So there is the science and spirituality are the two sides of a coin. When you look at the scientific spirituality is the unification of the two, which is desirable for this universe to come into existence. Actually, our sages, rishis were scientists of consciousness. They were actually scientists. They were experimenting on themselves. They were experimenting through their mental capabilities. Let knowledge come from all sides. This is what Rig Veda says. So this indicates that those sages were also actually scientists. Spirituality has a higher dimension. And if you look at science, it has a theoretical aspects and an experimental aspects. Similarly, spirituality has got a philosophical aspects and religious aspects. What is science? We are doing experiments to realize ultimate truth. Same way, spirituality is also looking at how do you realize ultimate truth. Only the path, the methodology adopted by these two are different. The science deals with experimentation to realize the truth, whereas spirituality uses experiential learning to understand the ultimate truth. So where do we link the science and spirituality? It can be linked at the level of silencing your mind. So once you silence, the link between science and spirituality comes. When you say Gayatri Mantra, Om Bhur Bhuvatsvaha Tatsavidur Varenyam Bhargo Devasya Dhimahim Diyo Yona Prachodayat. So when you recite this, there is tremendous vibrations in the electromagnetic field of your Sukshma Sharir that happens. So this has been studied by experimentalists by using aura, and this was also reported in the study. But I have spent most of my research endeavors in understanding the prophylactic, promotive and curative potentials of yoga. Yoga can prevent disease, It can promote your latent potentials, and it can also cure certain disease, particularly the psychosomatic disease. So I am going to give a glimpse of the scientific data collected over the last 4 decades in this field. Yoga is prophylactic. You name any disease, it will fall into any one of the 5 factors: the lack of exercise, dichotomy between mind and body, stress, pollution, and infection. Leaving away the genetically transmitted disease, you can attribute any disease to any one or a combination of these 5 factors. Yoga is prophylactic against all these 5 factors. Yoga is a total exercise, physical, physiological, and psychological exercise. Takes care of the first factor. Second factor is dichotomy between mind and body causing disease. So in yoga, even if you make a small movement, you are instructed to be conscious of the movement. If you are doing a pranayam, you are instructed to feel the air going inside and filling the lungs and energy flowing out. So you are uniting your mind with the body when you do this asanas, pranayam, and other yogic practices. So this takes care of the second factor, dichotomy between mind and body causing the disease. Third is stress. Stress can be an etiological factor, precipitating factor, or aggravating factor. Yoga takes care of this. How does it do? It normalizes your perception, the philosophy of life. We know why we are here. And it is to increase your karmic account, do good things in life, raise your divinity. So that gives the philosophy, so it normalizes your perception. So you don't get stressed at all, because your perception leads to the response, stress response. So yogic practice gives that philosophy which normalizes your perception. It optimizes your reaction. You don't exaggerate your response to a stress. It optimizes your reactions and also releases the stress as quickly as possible. So you come back to the pre-stress level at the earliest. So yogic practice takes care of the third factor, which is stress causing disease. Fourth is pollution. You can't live in a very clean BSL-2 or BSL-3 clean rooms, everybody. So you need to live in the environment and breathe the air what you have. But yoga strengthens your inherent detoxification mechanisms like liver, kidney, spleen, reticuloendothelial system, cilia. All these are strengthened, thereby taking care of the pollutants which might enter into our system. It is being decontaminated and then excreted out. So yoga strengthens the detoxification processes in our system. Fifth is infection. You can't live in the infection-free environment or BSL, biosafety level 2 or 3. So you need to live in the normal environment. But yogic practice strengthens your cell-mediated immunity and humoral immunity, which is there in your inherent system to protect any pathogen invading our physiology. So yoga strengthens our immunity, thereby giving protection against infection. So all the 5 factors, yoga is prophylactic, and we have the scientific evidence which has, based on which I am making this claim. Now yoga means what? To yoke, to unite body and mind, self with the universal self. So this is what our Jivatma with Paramatma, whichever way you want to interpret. The word yoga means to unite, to bring harmony. It started in our country 5,000 years ago. So yoga is our ancient wisdom. So if we have been able to give to the humanity something unique, one of them is yoga through our rich ancient wisdom. And Patanjali is the one who compiled all the Yoga Sutras, and we have various sects of yoga like Karma Yoga, Jnana Yoga, Bhakti Yoga, Hatha Yoga, Ashtanga Yoga, Kundalini Yoga. So like this there are various sects, Raja Yoga. But ultimately all this lead to realization of higher consciousness, raise your consciousness. That is the objective of the yogic practice, whichever sect you follow. And our existence is in 3 levels: Sthula Sharir, Sukshma Sharir, and Karana Sharir. Sthula Sharir is the physical body which I can see, all of you, so physical existence. There is a level of intellectual existence, so Sukshma Sharir, or subtle existence. It's not only at intellectual, subtle level. There is also at astral level, the Karana Sharir. Why I am here through this interaction with you in this integrative medicine conference, there is a purpose. So there is karana shariri, my existence for a purpose. So all this have to have a harmony if you have to have physical, mental and spiritual well-being. This yogic practice brings that, and even in your physical existence is at 5 levels: Annamaya Kosh, Pranamaya Kosh, Manomaya Kosh, Vijnanamaya Kosh, Anandamaya Kosh. So these are the 5 layers in which human level exists. So the spiritual evolution, yoga doesn't stop with just providing a good health, but it ultimately raises your consciousness, your divinity. So that is why the first level is providing good health, which is necessary to raise your spiritual evolution. The benefits of yoga through various studies which we have carried out with my team at the Defense Research and Development Organization and Amity Universities. And not only that, there are many reports, scientific reports and studies, papers available across the globe over the past about 5 to 6 decades. So when you look at all this, it has prophylactic, promotive and curative potentials, which I am going to talk to you. So there are asanas, pranayam, meditation. Most of the research which has been done encompasses these 3 dimensions, and we have looked at cardiovascular, respiratory, metabolic, cognitive and all other aspects with regard to the human health. Just reciting Om, there are reports that can produce phenomenal change in your physiology and the tranquility of mind. This is a study carried out in US. Now I am going to focus on what our team has done, our research team has done in the next 15 minutes. I will just give the glimpse of those results. We have given it on the soldiers. We have taken 100 soldiers in the control group who do the routine physical training program for 1 hour, and another group, experimental group, does in place of the physical training, they do yoga exercise. And the third group where we have combined the physical training, in the morning they will do yoga, in the evening they will do physical training. So it's a combination of yoga and physical training. So there are 3 groups. We have measured the physiological, biochemical, psychological, clinical parameters in these people during the 6 months period of their practice. Every month you see how these parameters keep changing in all the 3 groups. Just to give the glimpse of the parameters, I have just shown some of the laboratories here where we have done controlled experiments like measuring their cognitive functions, electroencephalogram, electrocardiogram, heart rate variability, functional MRI, putting the soldiers in a cold chamber, measuring their cold tolerance, putting them in a hot chamber with exercise. How do the cardiovascular, respiratory, metabolic responses happen in these 3 groups? So we have carried out well-controlled experiments. And the uniqueness is the soldiers, they have a standardized quality of life, their physical routines are decided, their dietary intake is controlled, regulated with a particular calories composition. So we have whatever outcome of these results are highly reliable, because these parameters will influence your physiological or psychological responses. So that is the uniqueness of the study which we have carried out in the Defense Research and Development Organization. Now to give just the salient aspects of the results, what yoga practice, this slide shows the heart rate. Initially it was at 70, now it has come to 58 or 60. So your heart, when it was functioning 70 beats per minute, now it is pumping only 65, the heart takes rest. So the wear and tear in the system will be much less in the people who practice yoga, because yogic practice builds the cooling system of the body, which is known as parasympathetic system. The heating system is sympathetic. So yogic practice, instead of bringing the sympathetic activity, it brings down the sympathetic activity and builds the parasympathetic activity or vagal tone, thereby bringing all the physiological functions to the lower side of the normal range. This will reduce the wear and tear. It's a conservation. Yoga is conservation of energy. And then because of this, it has a greater buffer to react to stress. Suppose you are already on the top of the normal range, your systolic blood pressure is 140, you will be shooting to 180. But if your systolic is at 110, you are going to reach about 140. you are still within the normal range, or it may become even 150 at extremely stressful conditions. So you see, it gives a greater buffer for people to react during stress because you are on the lower side of the normal range. So it optimizes your reaction to stress. Then because your cooling system, parasympathetic tone is better, this restoration of the pre-stress level of your autonomic equilibrium between sympathetic and parasympathetic is also faster. So the damage done due to stress is minimized because you come back to pre-stress level much faster. This is what yoga does. Our data which I am presenting in this indicate that with 6 months practice, the heart rate comes down, systolic blood pressure comes down, diastolic pressure comes down, but within the normal range of normalcy. Similarly, breathing rate comes down. Then we looked at the mental tranquility because everybody claims yoga brings a cool mind. We looked at the electroencephalogram, which has got 4 bands, delta, theta, alpha, beta bands. The tranquil waves are alpha and theta. Primarily alpha is 8 to 13 hertz and theta is 4 to 8 hertz. So we have shown in this slide that your alpha activity, the preponderance happens, and also your heart rate variability spectrum, which is shown here as the waves, that it shows the buildup of parasympathetic tone. So we quantitatively measured the shift of autonomic equilibrium to parasympathetic preponderance. That means our physiological cooling system is strengthened. Then alpha index of EEG goes up, which indicates the tranquility of mind, which is also shown in these 2 slides, impact of yoga. Then we looked at the MRI, magnetic resonance imaging, functional MRI, and those people who practice meditation, Raj Yoga meditation for more than 10 years, we found activation of prefrontal cortex of the brain. Prefrontal cortex of the brain is very important for decision making, intuitive thinking, and also looking ahead, perspective planning. These are all higher nervous functions, and by meditation you are able to build that capability, which is seen in this slide. There is an activation in the prefrontal as well as occipital part of the cortex, which is shown in the functional MRI of the practitioners of meditation. Now, heart rate variability also indicates during meditation that you have a relaxation, but it is alertful relaxation. That is what is important. It is not sleep, it is an alertful relaxation. Then we also measure the body flexibility. If somebody starts at the age of 45, middle age, can that benefit to increase the suppleness of the body, flexibility? So we measured at various joints like shoulder flexion extension and elbow, then neck rotation, and also we measured the angle of rotation, extension, flexion, then trunk flexion extension. We quantitatively measured by using goniometer, and we found that even if you start at the middle age, between 40 to 45 also, it increases the body flexibility, which is very important to remain active, usefulness, and also prevent your musculoskeletal disorders like low back pain or the cervical pain. So this is important. This slide shows that the body flexibility improves after 6 months, 3 months and 6 months of practice, that the body flexibility increases. Then we put these people on a bicycle ergometer and treadmill, and we measured, we gave a quantitative workload to the people to exercise at the particular workload, sub-maximal level of workload, 40% of their maximal. Then we were measuring how does the cardiorespiratory, metabolic functions happen during the exercise. So we measured their cardiovascular respiratory functions. Then we also measured the lactic acid, which will indicate the anaerobic metabolism. So whenever your system goes into oxygen debt, that means you are giving energy, you are getting energy, but not through aerobic way, but it is through anaerobic way. That time the lactic acid, pyruvic acid, all this go up. So we have found in the yoga practitioners, the rate of buildup of lactic acid is much slower than a normal control group. That means he will be or she will be able to sustain that submaximal level of work for a longer time. So thereby the fatigue onset will be much less. So that's why you will see people who practices yoga, meditation, they are working in a relaxed way, and they will work for a longer time without fatigue, without stress. So this is what this slide shows, the rate of build-up during exercise is much slower than in the normal people. It may be much faster. This is shown in this slide. Then we looked at the biochemical profile. What happened to resting or basal blood glucose, cholesterol, total proteins, lactic dehydrogenase, lipoproteins, and also dopamine beta hydroxylase, which indicates the sympathetic activity, and also hormones like plasma cholinesterase, then the metabolic end product of cortisol. All this we measured. This slide shows that yogic practice bring all the functions, whether it's glucose or cholesterol, to the lower side of the normal range. So there is a hypometabolic state is produced by yoga practice, thereby there's a conservation of energy. This is what is this table indicate. Then we put these soldiers into cold chamber, 10 degrees, with no clothing for 2 hours. There is only shorts on. Then we measure their core temperature, mean skin temperature, shivering by recording electromyogram, which will indicate the muscular activity of shivering. Then we measure their oxygen consumption. So what we found, that yoga group maintained the temperature falls, core temperature falls in both the group, but relatively yoga group maintains a higher core temperature, that is aura temperature, intraoral temperature we measured. And so that indicates that yogic practitioners are able to maintain a higher temperature, better cold tolerance. And then we looked at how it was achieved. Then we looked at the mean skin temperature. That means the cutaneous circulation, the circulation to the periphery, the skin. How is it in both the groups? It was almost the same. So this higher maintenance of temperature was not achieved by vasoconstriction of the blood vessels or reduction of the blood supply to the skin, but it was achieved by heat production. It is not by heat conservation, but heat production. There are 2 methods of heat production. One is by shivering you can produce heat. The other one is metabolically and without shivering, non-shivering thermogenesis. So we found through these slides that this was achieved by non-shivering thermogenesis, because EMG showed, electromyogram, that shivering started much later and was of a lower magnitude in the people who practiced yoga. So that is why we see yogis living in mountains. When we put too many layers of clothing, they just put a linen and they just keep moving around at sub-zero temperatures. So this is what is even a common man like a soldier can get. Soldier is in uniform and we are not in uniform. That's the only difference, but the physiology is the same. So even a common man can augment his or her cold tolerance by the practice of yoga. That is what this slide shows. Then we measured their psychological profile. What happens to anxiety, depression scores, alertness. So we measured them quantitatively by using standardized psychological tests. So what we found, the anxiety level comes down. That is, state and trait anxiety goes down and depression scores goes down. So you always live lively. So depression score, this is what the histogram shows. Your concentration goes, attention goes up, and also vigilance goes. Your mind is vigilant, alert. So this is what is the 4 histogram which I have shown in this slide. So yoga not only has physical benefit, but it has got psychological benefit of improving your cognitive functions, concentration, memory, learning efficiency, eye-hand coordination, which is psychomotor performance. These are all vital for everyone, not only for soldiers or pilots who have to fly a fighter aircraft, but it is important for everyone. So yogic practice does improve these cognitive functions. Then we also looked at diabetes is in the rise. So can yogic practice prevent the incidence of diabetes? So we looked at the glucose tolerance test. In the normal people, they are not diabetic patients. Then we looked at how does the carbohydrate handling mechanism happens. GTT, you give a load, fasting, you give a load, known load of glucose, see how the body handles for 2 hours. So this is what is GTT. We found that the rise due to this glucose load is optimized and clearance is much faster. So that means your carbohydrate handling mechanism is much strengthened by yogic practice. This is what is shown in this graph. Then everybody claims yoga is good for hypertension. It brings the blood pressure. But we addressed how does yoga brings the blood pressure back to normal level. So we had the hypothesis that if you have to establish hypertension, you have to knock down the sentinel, the chowkidar, keeping a watch on your blood pressure. That is known as baroreflex sensitivity. There is a receptor in the carotid sinus, which is the blood vessel which supply the brain, the blood. So there, this receptor is a baroreceptor, responds to pressure variations. So we measured, we found that this receptor goes sluggish in hypertensive patients. Then can we reactivate this sluggish baroreflex? Can we wake up this chowkidar, who will in turn correct the whole process of the blood pressure maintenance? So this is what is the experiment we did. So what we did, we took 40 of the essential hypertensive patients, divided randomly into two groups, control group and experimental group. Control group was put on a tilt table, a table which is tilted 70-degree head up or 45-degree head down. So we put the patient has to lie down on the table, and the table is tilted 70-degree head up or 45-degree head down. In the other group, experimental group, we selected asanas, yogic asanas, which involves a postural tilt. For example, Ardha Halasana, Viparita Karni, Sarvangasana, all these are head down tilt. So your head is down, leg is up. So when you do this, it stretches the receptors, the carotid sinus receptor in the blood vessel supplying the brain stretches. So the receptor gets activated. Then when you do the reverse, Bhujangasana, Dhanurasana, Surya Namaskar, where your head is up, leg is down, that time it releases the stretch. So you are stretching, releasing the stretch, by which we are able to activate the sluggish baroreflex, which in turn correct all your metabolic disbalance, like renin-angiotensin gets corrected, catecholamines, adrenaline, noradrenaline comes down, blood electrolytes gets corrected. This is what I am showing in this slide, that your norepinephrine level comes down, plasma epinephrine levels come down, and urinary excretion of catecholamines also coming down. These are all indication that how this yoga brings the blood pressure back to normal. Everybody claims that. And we also found the EEG, alpha index of EEG goes up. So there is the mental tranquility. It's not only here, but it's also through mental tranquility. Now the last part of my the presentation is on the curative aspects. Can yoga cure disease? Because everybody claims that yes, psychosomatic ailments particularly it can help. So we looked at coronary artery disease. Coronary artery disease is the blockade of the coronary vessels supplying the myocardium, the heart muscles. So we found that those people who had even 70% blockade, we demonstrated through our experiments on Raja Yoga as well as lifestyle intervention, which included regular aerobic exercise of walking morning half an hour and evening half an hour, and low fat, high fiber diet, which is 15% fat and high fiber through vegetables, sprouts and also fruits. So increase the fiber content of the food, and then Raja Yoga meditation. Through this lifestyle intervention, we were taking care of 3 risk factors. One is the sedentary living, you are taking care by walking. And the other one is dyslipidemia, where you have the LDL going up and HDL going down. So we had to correct the dyslipidemia, which is another risk factor. Third is stress. So we took care of stress by meditation, Raja Yoga meditation, and the dyslipidemia by a diet control, and the lack of exercise, sedentary living, by making them exercise by walking. What we found in this slide I am going to show, that all the functions, we measured many parameters, but I am showing 1 or 2 parameters. One is the stress level comes down, the lipid profile gets normalized, then the melatonin rhythmicity, which is important to control the tranquility. So we found melatonin rhythmicity gets corrected. Then we measured the angiogram, coronary angiograms, which will indicate actually the blockade. And in this control group, there is progression of the plaque, whereas in the experimental group in the next slide, 78.85% blockade which was there when we started this lifestyle intervention. But after 2 years, we found this block has become 47.02%. So you see what a remarkable, from 78% to 47% blockade. So the perfusion improves in the myocardium. So the coronary angiogram we did on 524 patients, and then they were randomly divided into control group, which is a conventional medical management, and in the other experimental group, we gave the lifestyle intervention. So this is how we had demonstrated in these angiograms. Here is a patient, 89% blockade in the coronary vessel. Now after 2 years of this intervention, 41%. So this is a very remarkable change in the coronary artery disease. First time in the world literature, our study indicated coronary artery disease regression. Even Dean Ornish showed only arrest of the progression of the disease by keeping the patients captive in a hotel, putting them in a regimented control of schedules, but here we left them in their natural environment of home. So this is a very unique study which we published in the Heart Journal. Now this shows the mechanism, how does this lifestyle intervention brings the whole normalcy. Now the last part is Agnihotra. Everybody, Havan, we perform Havan. We did experiments on this. When you say Suryaya Swaha, Suryaya Idam Namama, Prajapate Swaha, Prajapate Idam Namama. This Agnihotra is recited in the morning at sunset, exactly at sunset. Suppose in Chandigarh, if the sunrise takes place at 5:57, so this has to be done exactly at that time. So the time is critical. Then you have a reverse pyramidal vessel, copper pyramidal vessel. You put the cow dung, cow ghee and full rice with ghee. You recite exactly at the time of sunrise and then put it there. And then we found when we were recording electroencephalogram, which is 10 to 200 microvolts is the strength of the EEG. Your ECG is 1 millivolt. So these signals, we found suddenly all these needles were showing DC shift, indicating the body is acting like an antenna, harnessing a very high level of energy coming to them. So when you are recording EEG, suddenly it shifts like this because this is what I am showing in this graph. How does the shift occurs in the Agnihotra when you perform, and this indicates that your body, like an antenna, harnessing a very high level of energy coming at that time, which is harnessed, funneled into the Agnihotra vessel, radiated back to the environment, which is picked up by the body like an antenna. This is what I have shown in this recording, where you see how does these neurophysiological parameters we measured, the alpha index, you see the disturbance, and also the compressed spectral array indicate. After it stops, then you have relaxation. This is what is shown in this slide. And then we also measured their galvanic skin resistance. That also showed a rise, indicating a relaxation of the body and mind. And this is what is given in the form of the table. And finally the message, the last slide, blend science and spirituality for a holistic healing. Because if you treat only body, it's not a holistic healing. Because your problem, the disease causing factor may be in mind. So it is always necessary to have a mind-body approach to have a holistic healing. But when you look at the allopathic system, it treats your body. You have a cancer, you just remove the cancer and then also give the radiotherapy, chemotherapy. You are treating only the body. Whereas the cancer was caused by some other factor, could be elsewhere in this Sukshma Sharir or in the mind. This is what is the yogic practice. It's a holistic healing which takes care of the mind, body, soul. So that is why the complete cure. And in all the traditional system, this is it. Man as a whole is seen rather than as a body. So this is the final message. Try to link that. Don't stop with the health. How does these practices can elevate the divinity of a person, the spiritual consciousness of the person. Having attained a good health, that is the ultimate moksha, salvation is the aim. So I am very happy to have participated through the web link, and I wish I was personally present to interact with you and also to discuss some of the findings. I am sure you are all going to have an intellectually enriching experience in this conference. I wish the conference a great success. Again, Sachin Gupta and also Nimrit, congratulations on your endeavor and taking part in this to organize such a massive important event. Spread the message globally. Ultimately, the whole globe look at how this integrative medicine is important for the humanity to provide a positive health care. Thank you very much.